Good evening, and welcome to this volunteer briefing on ensuring access to FDA-approved Alzheimer's treatments. I'm Beth McMullen, Senior Director of Grassroots Advocacy for the Alzheimer's Association. This evening, we'll be providing you an update on a decision by the Centers for Medicare and Medicaid Services that is blocking access to new treatments that have been approved by the Federal Drug Administration for those with mild cognitive impairment due to Alzheimer's and early stage Alzheimer's. This evening, we're going to be using a few acronyms for these federal agencies: CMS for the Centers for Medicare and Medicaid Services, and FDA for the Federal Drug Administration. I've invited a fellow volunteer of yours who is living with early stage Alzheimer's to share his perspective about these developments. And finally, we'll tell you how you can help us demand equitable access to FDA-approved treatments. First, I want to thank you all. As volunteers for the Alzheimer's Association, you are an incredibly valuable part of this community. Without you and your work in the community, we would not be able to reach as many people impacted by Alzheimer's and all other dementia. Together, we're stronger, and we appreciate you taking the time this evening to learn more about this top priority and how you can make a difference. We won't be taking questions this evening, but if you have any questions at all, please connect with your local staff partner. To get us started this evening, it's my pleasure to introduce Alzheimer's Association Chief Public Policy Officer Rob Egge. Rob?
Thank you, Beth, and good evening, everyone. It's great to be with you. It's always more enjoyable if we can be together in person, but this is a great substitute. I've noticed some names of great friends of ours who have popped up already. Thank you for joining, and it's always great to meet new people, even if it's a one-way introduction at this point. Thank you so much, whatever your level of involvement has been so far on this issue. Thank you for being with us tonight and giving your valuable time. I can't think of a more important moment and issue to give it to than what we're going to talk about this evening. And I don't say that lightly. I've been working on these issues with the Alzheimer's Association since 2009 and on Alzheimer's policy prior to that. And all the time that I've been working on these issues, I thought even in 2009 about the people who had been working for years before I ever started focusing on this, for decades. And if there's one issue that people have been working for all this time, it's to have truly meaningful treatments for Alzheimer's and all other dementias. That's been why we've been advocating so successfully over the years for increases in federal research funding, and for so many other areas that we focused on together. We know how difficult dementia is to deal with, what it does to individuals and families, and we know there has to be a better future that we're going to fight for and secure. So the exciting thing is that moment that we've been pushing for, a moment where we get beyond the few symptomatic treatments that we've had for so many years to things that can really change the course of this disease, that era that so many other chronic diseases have entered into long ago. At long last, we have arrived. We have the first FDA-approved treatments on the basis of actually changing the course of the disease. And that is so exciting. At the same time, of course, that excitement is tempered by some realities it's important to say right up front. So first of all, as many of you know well, but some of you may be hearing for the first time when we describe these treatments, they are only at this moment for Alzheimer's. There's many other causes of dementia. This only addresses Alzheimer's. That's the first thing just to keep in mind at the outset. And second of all, these treatments are for those in the earliest symptomatic stages of Alzheimer's. So we know that Alzheimer's can start well before symptoms. It's not at this point indicated for that period of time, nor is it sadly indicated for after we have progress past this early stage of symptomatic Alzheimer's into the mid and advanced stages of the disease. So there's those limitations. And then finally, I put on top right at the outset that we recognize that these treatments are very important, but they're only to be part of the picture, even for the population I mentioned. We know that where we need to go is to treatments that affect address this disease and all the causes of dementia from many different angles. That's the success that we've had in many other chronic diseases, is that kind of multifactorial approach from different dimensions, different ways of getting at a disease. Those of you who are at the forum heard from our Chief Science Officer, Dr. Mary Carrillo, about the many aspects because of the research funding increases that we fought for and the generosity of people participating in walks and others who help us raise the funds that we can devote at the Alzheimer's Association of Research, that we're able to take all those different approaches. But right now, let me get back to what this evening is so much about and why we're so excited about this moment we're in. Because even with all these different things that are important to keep in mind, we have finally crossed into this new era of treatments. And it's so important for us at this moment to, of course, recognize what we've accomplished and to make sure that it's available for everyone who could benefit. And that's what this evening is about. So let me start out with a few different facts for you. The first is about what's happened to this moment. Where are we right now? And then the second is, what's the problem we face? And the third aspect that we'll talk about this evening is how we're going to get past it, how we're going to overcome it together, just as we've overcome so many barriers throughout dealing with Washington and state policy over the years. So in the slide before you, you can see roughly in a little bit over a year and a half where we are. And I'll pick up the story with about a year and a half ago, the first treatment in a class of drugs that go by the very intimidating name, anti-amyloid monoclonal antibodies. That's the name of this class of treatments. And prior to this moment in June 2021, on the far left-hand side of the screen, we had been working in this area for a long time as a broad research community. And there had been many approaches to developing these treatments that hadn't got across the goal line in a large trial to show success. But with each one of these trials, we learned more and we made further progress towards unlocking what needed to be secured to have effective treatments. And the first time we crossed over from near miss into success in the view of the FDA was with the first treatment to be approved by the FDA in this class called Aduhelm. At that time, you may remember very well that this was a controversial time. And as we enter this new era of treatments, we're once excited, but also dealing with controversy. The controversy in part stemmed from the choice of the manufacturer to charge a very high price for that drug, for that first drug, Aduhelm. And we and others joined voices in saying it should be lower and pushed for that. The other thing that made that moment where we just entered into this new era controversial was the way that first trial was conducted for this drug called Aduhelm was messy. It was complicated. They had stopped that trial and realized, wait a second, it was working better than we realized, and they restarted it. So they got the data to FDA, but with that start and stop that caused people to have those grounds to sort of debate, what did this really mean and how confident can we be? We think the FDA made the right decision despite that confusion when they approved the drug. And regrettably, we think that CMS made the wrong decision. CMS is the agency of the US government, as Beth was describing, that runs the Medicare program. When they issued a policy that goes by the name of National Coverage Determination, not that you have to remember this jargon, but just for context then, as you'll see in the slides before you, where they started a process and ended in April about 1 year ago, where they released a new policy in the context of this controversy that said something very sweeping and unprecedented. Two things I want to highlight about this decision that were really regrettable. The first one is they said that for the first time ever, an FDA-approved drug would not be covered by Medicare. Never in the history since the 60s in the Medicare program had that ever happened before, where FDA had approved a drug and Medicare, CMS said Medicare won't cover it. So that was unprecedented, very disappointing. Second of all, they went beyond that and he said, not only are we going to make this decision for that one controversial treatment, but we are going to make that for this entire class of treatments even those we haven't yet had an opportunity to see the evidence for, even those drugs in the class that might not even have been thought about yet, that haven't entered into trials. We're going to say right now that now and into the future, these drugs will not be covered by Medicare unless we decide otherwise in our own judgment. That also had never, ever happened before. So we found ourselves in a very unusual moment. And we said, this is going to be a problem. And sure enough, within half a year, last December, that problem became very, very evident. Beyond the fact that people couldn't access that first treatment, Aduhelm, we saw even the further implications of this that we and others predicted. That was the fact that when the next treatment in this class has sort of come down the pike, called Leqembi, you may have heard it referred to perhaps by its scientific name, lecanemab, when its results were released around Thanksgiving time this past year. Now, whereas the drug Aduhelm had sort of a messy trial that was sometimes hard to interpret by some people, in this case, the trial was pristine. It was done exactly the way researchers and regulators would say such a large trial, final trial, what's called sometimes a phase 3 trial, should be conducted. It left no ambiguity about the results. It showed that, as it was written up in this leading medical journal where the results were published, the New England Journal of Medicine, that it showed a moderate impact, a moderate improvement versus what's called the placebo group in terms of health outcomes, cognitively and functionally. As a matter of fact, in one of the measures used, that captures, has been used for about 30 years, that captures what patients report they care about most. That's why the instrument was designed, and monitors those things, and caregivers as well. It showed about half as much progression in those receiving treatment than those who didn't. So slowing by half in terms of that progression in one of those measures. So as I said at the outset, it's not the answer, the end all be all of what's needed. We have much more to do that we want to combine with these treatments, but they are an exciting advance over where we've ever been before. But because of that regulation, though, that treatment too would be unavailable. And sure enough, this past January, when the FDA approved this new treatment based on trial results, we saw that those who would otherwise be fit the FDA's label and be able to access it could not under Medicare. Medicare would not pay for it. We asked CMS, based on this new evidence, to revise that policy, that national coverage determination. They refused to do so in February. Good news that shows that we're on the right track here together in our advocacy. One confirmation of that is the fact that many of the leading researchers across the world, over 200, have signed on to a letter that we organized saying that this should be covered, that this treatment works and it should be available. The second thing that's an indication where they can have confidence for what we're advocating for is the fact that the Veterans Administration, which is no easy grader when it comes to evaluating these things. As a health system, they're one of the largest payers, and they have a very rigorous way of evaluating this evidence. They also looked at this drug, Leqembi or lecanemab, and they said, this is right for US veterans. We're going to cover it and make it available. So when we advocate for where we need to go, we are on very, very solid ground in arguing for the fact that this unfair and unjustified policy needs to change. Let me capture that with the next slide and head towards wrapping up here with just a few points. So first of all, this is urgent because, as I said, these drugs are only right now indicated for those in the earliest symptomatic stage of the disease. That means when we don't move fast enough, and we, in this case, as Medicare, making this available, people actually continue to progress, as you all know, and they can progress right through this period of eligibility and lose their chance to access it, which is terrible. And we estimate that more than 2,000 people per day with this early Alzheimer's progress past the point of being able to access it. And that's something we just can't stand by and watch happen. We have got to advocate to make sure that not that everybody in that group has to take it, by no means, but everybody in that group should have the right to decide with their family and their healthcare providers if they wish to take it, if it's right for them. And if they make that decision, then it should be covered by Medicare, just as every other drug for every other disease approved by the FDA is today covered by Medicare. That's what we're fighting for, is that right for them to make that decision for themselves, who fits that FDA label. So the other reason is, and I'll kind of wrap it up with this point. The other reason why this is so important for us is because we are battling over a precedent. Throughout the history of this disease, including in policy, but even if we step back from policy and just think about the stigma of this disease that we have worked together to overcome, to make this a disease that we can talk about and people can come forward when they have it and seek the care they need and get the support they need. But if we move into the realm of policy, we look at what research funding used to be before we fought together to increase it sevenfold to where it is today. Throughout that process, we have always had to battle as a community, regrettably, to make sure that we overcome the prejudice and the precedents that can hold our community back. And this is such a case. The science is there, the patient need is there. What needs to change now is the policy standing in the way so that we can move forward into this era of treatment and welcome it and make this available for those who could benefit today and wish to take it, have access to it. So with that, Beth, I will turn it over to you as we talk about where we're going to go next.
Thank you, Rob. I really appreciate how you've outlined what's this new era of treatment that we're in. And now I'd like to turn to one of your fellow Alzheimer's Association volunteers. Joe is a current advocate volunteer from Massachusetts and a former member of the National Early Stage Advisory Group. As an advocate, he has spent countless hours advocating for policy priorities with elected officials at the state and federal level. Tonight, we welcome him to share his personal perspective as someone who could potentially benefit from these new treatments. It's my pleasure to introduce Joe Montminy. Joe?
Thank you very much, Beth. You know, Beth, when these new treatments actually started getting FDA approval, it was the first time since getting my diagnosis that I had this feeling of hope. You know, kind of hoping that I could slow down the progression of my disease so I could spend more time with my family and possibly even enjoy some of my retirement. You know, and these are things that I thought I might not be able to fully enjoy. You know, because you have to realize that, you know, when we get our diagnosis, there's so many things that go through our head. And it's not only how the disease is going to impact my family and myself, which there are a lot of issues there, you know, but you also have to realize that there is no hope for my future. You know, my doctors, they were very focused on telling me that I needed to get my affairs in order and how I needed to deal with the progression of my disease as things got worse. But they never discussed anything positive about my future. And that's why we need to get out there and ask CMS to reverse this ruling, because these treatments finally give us that hope that we've been missing. And, you know, when Medicare actually decided not to cover these treatments, I was devastated knowing that there's this FDA-approved treatment that is right there at our fingertips, and CMS was broadly denying us access to these treatments. I feel that CMS should give us access to these treatments, provide us with the information and benefits, the information on the benefits and the risk associated with these treatments, then let me make that decision. And I would clearly reach out to my healthcare providers for professional direction. But as someone dying from Alzheimer's disease, it really should be my decision to make. And I also feel it's unfair that CMS is forcing me to choose between, taking care of my family's financial health and trying to slow down the progression of my disease. Because like many other people with younger onset Alzheimer's disease, and these are people most likely eligible for these treatments, I was forced to retire early. I received my diagnosis when I was 54 years old. And I worry that I don't have adequate retirement savings to support my family. we cannot afford the $26,000 annual cost for these treatments. And I'm sure that most of you on this call tonight would not be able to afford it either. And our underserved populations, they're the ones that are going to be the hardest hit by these decisions. And that's why we need to ask CMS to provide us with the insurance coverage that we're actually entitled to for an FDA-approved drug. Because these treatments, when taken in the early stages of this disease, they could provide a better quality of life for myself and the thousands of others that are in the early stages of the disease. For me, it would allow me to spend more time with my wife. We enjoy going for walks along the coastline and hiking. I could spend more time with my two sons. They're in their mid-20s. They've just started to work professionally, and they'll often call me to ask for advice. I enjoy getting those calls because often I can help them. But I do worry that someday I'm not going to be able to help them. Like any parent, I would love to see them get married and have children, because I love spending time with children and hopefully my grandchildren. Basically, I just want to experience some of the activities that most of you take for granted. And I want to do it at a time when I can enjoy them most. And that's during the early stages of this disease. And although this might not be considered a breakthrough to some people, for me, with someone who has a much shorter life expectancy, these treatments are significant. And CMS needs to realize that we don't have the luxury of waiting for scientists to find that perfect drug. I know I've seen declines in myself and for some of my closest friends in just the last year. For me, everyday projects around the house, even doing something as simple as emails, are now taking me 2 to 3 times longer than they did a year ago. And that's frustrating. And my wife and my mother have told me that they've noticed changes in my personality. They say I have more mood swings, that my ability to reason is declining, and I have less impulse control. I'll tell you, that is very concerning to me. And for some of my friends from my Alzheimer's support group, I've seen some of their declines that are even more severe. If you go back a year ago, some of them were very active voices in my local support group. Others were helping me raise awareness of early stage issues around the country for the association. If you fast forward to today, and some of them have a hard time responding to basic questions, and some of them are no longer eligible for these treatments. They're part of that 2,000 people that Rob talked about that have moved on from being eligible, very likely being eligible, to later stages or even long past that. So that's why CMS needs to realize that these treatments are a critical first step. And we need to take small steps forward with treatments like these that are proven to work if we are going to get to a day when we can live with Alzheimer's disease and not die from it. So I'd like to wrap up by just sharing with you something that I've heard from a good friend of mine, Dr. Bruce Lamb. And he said this a few times, and I think it's great, that this is a momentous occasion because we are at an inflection point with Alzheimer's research and treatment. It is a time when there is more hope than ever before in treating Alzheimer's disease. And I totally agree with him. And that's why we have to get out there and tell CMS we need access to these treatments, because these treatments can change the course of our disease in a meaningful way. Thank you, Beth.
Thank you, Joe. Thank you for sharing your insight as someone living with Alzheimer's. And for all of you, Joe is just one perspective. I'm sure you know people living in your community, your own personal circle, your family who are living with Alzheimer's. I encourage you to hold that person in your mind now as we talk about what you can do to help us change this unjust decision. Remember, we're not asking for special treatment for Alzheimer's. Medicare covers FDA-approved cancer treatments. They cover FDA-approved medicines for heart disease, for every other disease. The Alzheimer's Association and our advocate volunteers, some of you here on the call tonight, have been working to change this decision since it was announced last year. You heard Rob touch on what we as an association are doing to communicate a very strong, clear message to CMS, to the administration, and to Congress that this decision must be reversed. Advocate volunteers have spent countless hours talking to members of Congress in their states, writing letters to the editor, speaking at town hall meetings. Earlier this year, as advocates from across the country gathered in Washington, D.C. for the annual advocacy forum, we made a special appeal to the Biden administration, rallying outside of the White House. I want to show you this highlight video from that rally to show you the passion and the energy of your fellow volunteers that they brought to this fight. We'll hit play.
For my mother, Maxine, who's in memory care.
And my mother had Alzheimer's.
I lost him 2.5 years ago. And sorry, it still seems like yesterday.
Access to care is just important because every patient deserves the opportunity to make a choice about their care.
I look forward to the opportunity to have treatment for my Alzheimer's.
CMS, we need access now. We need to have access now.
We need you to help us. Give us a little more time. Help us. What we doing? What do we want? Access. What do we want? Hey.
Tell them we need access now because this is the beginning of the treatment era.
If the only way you get access treatments is to take out a second mortgage on your house, that's not health equity.
We need CMS to step up, to listen to the community, to listen to the science, and to stop blocking access to these treatments.
As we go to Capitol Hill tomorrow, we're going to be carrying people from all around this country, and we are not going to stop there. I'm not asking for a miracle. I'm asking for a little more time.
Thank you. So I hope that inspires you to join this effort, this fight, and to take action today. You heard fellow volunteer in that video, Joe Arciniega, say, we're not going to stop there. And you know what? We didn't. The day after this rally, advocates went to Capitol Hill to meet with nearly every member of Congress. And our top ask for them was to tell CMS to change this decision, to stop blocking access to these FDA-approved treatments. And we've continued this fight in the weeks following the advocacy forum. We've had over 50 advocates join us on Capitol Hill for 6 hearings over the last month, filling those hearing rooms with purple. Showing broad bipartisan support for our position, members from both political parties in both the House and the Senate asked pointed questions of the Health and Human Services Secretary, Javier Becerra, and the CMS Administrator, Chiquita Brooks-LaSure, about the CMS decision to block access to these treatments. But we're not stopping there either. This week and over the coming months, advocates will continue to seek opportunities to talk with their members of Congress while they're home in their districts back in the state, asking them to continue to put pressure on CMS to change this decision. And starting next week, they're holding rallies in 11 cities across the country where CMS has regional offices: Seattle, San Francisco, Denver, Kansas City, Dallas, Chicago, Boston, New York, Philadelphia, Atlanta, and finally in Washington, D.C. And then this June, we'll be holding rallies in every state across the country. The goal of these community rallies is to show decision makers at CMS and in the Biden administration, the continuing nationwide concern and anger about Medicare's unprecedented refusal to cover these FDA-approved treatments. We will be relentless. We will continue to bring the purple passion of this community, people like you, to change this decision. We have 3 things for you to consider tonight. How you can take action tonight and in the coming weeks and months. First, sign our petition. You can scan the QR code on the screen or click the link that I will drop in the chat. I just want to make sure I'm dropping that in. And of course, my chat is hidden. So I'm dropping the chat in the dropping the link in the chat, or you can scan this QR code on the screen to sign that petition. Second, we hope that you'll consider joining one of the rallies in your community, whether it's in the next couple of weeks in those select cities or in June in each state. Contact your local chapter partner for more details and to sign up. And third, be an advocate. Take action and ask others to join you. By signing the petition, you've taken the first step. And now we want you to share that link with everyone in your network. Share it on social media, share it with your friends at the local potluck, share it with your family when you're sharing a family holiday or event coming up soon, and share it with others in your volunteer network within the association. I want to leave you with a simple message. We now have access to treatments proven to alter the course of this disease. We're at a turning point, and people need CMS to ensure access. This is urgent. You heard Rob say it. Every day, 2,000 people move to a more advanced stage of Alzheimer's where they're no longer eligible for treatment. Joe and others like him deserve access now so that they can have more time for whatever it is they choose in life. We need you. With volunteers across the country and in every community, the Alzheimer's Association is the only organization that's positioned to make this happen. I want to thank you for coming tonight, and thank you for all that you do as a volunteer. And I hope you have a great evening wherever you are. I'm going to hang on for just a minute because I want to drop in the chat links to the CMS rallies that are coming up in the next couple of weeks. So take a moment if you're here live with us and copy those links for a city near you. And if you're watching this in a recording, please just reach out to your local chapter office and they'll be able to help connect you to the rally opportunities in May at the CMS offices and to the rally opportunities in your state in June. So again, thank you all very much for joining us here this evening. I hope you have a wonderful night. Thank you.